The most common and worst way to treat arthritis. How many of you think you know what that is? All right, you're going to find out about it. In my opinion, it is steroids. Now, steroids can be administered orally or topically through creams or ointment, or by injecting these steroids into your joint. And they work by inhibiting production of inflammatory chemicals called cytokines. And they do reduce symptoms that are associated with inflammation. But do they work is the question. Now, in this study, a group of 140 men and women over the age 45 who suffered from knee pain, osteoarthritis, were randomly assigned to one of two injection groups. Injection group 1 got the corticosteroids injected, and 2 got a saline placebo, so just water injected in there. And what did they find? The intra-articular injections were administered every 3 months for 2 years. And they followed up on these people significantly with questionnaires, physical ability tests, annual bone and joint magnetic resonance imaging to see how they were progressing. And at the end of the study, guess what? There was no noticeable difference between the two groups in terms of joint pain and stiffness. Both groups performed equally well in terms of standing from a seated position and walking. Now, there are some potential side effects from steroid use, and 3 common ones are osteoporosis, which is loss of bone density, cataracts, and increased risk for diabetes. And I'm only mentioning 3 of the myriad of potential side effects of using steroids. And you also have to realize that sometimes they actually make things worse. In a 2019 study, 8% of the participants with osteoarthritis in their hips or knees, and they got 1 to 3 steroid injections, actually ended up getting worse. Another study that was extremely concerning was this one, where they had an injection into the knee, and they found that when they did that, they doubled the cartilage volume loss compared to the placebo. Now, the cartilage is what maintains that space in your knee joint, and when that cartilage is gone, you're going to have a knee replacement. One last case, and this is a scary case, it's just one, but October of 2019 in the Atlantic, a lady, after giving birth to a child, was having hip pain, so they injected her hip with a steroid. She came back 6 months later, pain so severe she cannot walk. They did imaging studies and found out the head of her femur bone was gone. Now, they couldn't confirm exactly what happened, but the doctor involved suspected the bone loss might be related to the steroid injections. Now, I want to warn you, if you're taking steroids, you don't want to abruptly stop them, because it can cause adverse reactions and even potentially cause death, depending upon how long you've been taking them. So here's your action steps. I want you to be very cautious about using steroids. Talk to your doctor if you are. And I want to encourage you to use the 7 systems plan to maintain your joint health.